So we have this lovely friend of mine. She has had many treatments with the anti-wrinkle. She's had specific chemical peels for reducing the pigment. She's had Morpheus8 to and fillers along the jawline to give this really nice sharp jawline. And one of the things that she came to me with was the hollowness in the temples. And this is a part of the aging process. Normally, there are fat pads. And so when we are younger, this area is fuller. Now, the implication of hollowing over there is that if it is hollow over here, the brow starts dipping down, and so does the upper eyelid. So, by filling out this area, you blend the temples into the cheekbones. So she's got lovely zygomatic arch, very nice cheekbones, but they stand out too much, and it gives her this kind of skeletal appearance over here. So we just want to blend the temples into the zygomatic area by doing temple fillers. We use Bellatero volume. We will demonstrate how we do it. We do it under ultrasound guidance because there are some critical blood vessels that go in this area, which we can encounter if you're going completely blind. So we do the ultrasound to tell us where the vessels are. We do the ultrasound at the end of the procedure to make sure that the blood vessels are working well. It's a advanced level treatment, so you have to be experienced enough to be able to do this, but when done well, it gives a lovely result. We'll talk you through the procedure as we go. Okay, so this is the temporal fusion line. This is the lateral orbital rim. This is the zygomatic arch over here. And about here is where we are going to fill. So we're going to fill some behind the hairline because it has got this effect of pulling up the lateral brow or the outside of the eyebrow. Now we are going to enter somewhere around there, and we are going to have a look under ultrasound as to where the blood vessel is. Same thing over here, temporal fusion line, lateral orbital wall, zygomatic arch, and then we are going to go over here. So when I look at it from the top, clearly this one is a wider defect and a bit more pronounced on the right side compared to the left side. So we have got 1 syringe per side, but we might use more than 1 syringe on this side and a little less on that side. The advantage of dermal fillers is that it shows the changes as it goes in. So we can evaluate the results as we go along. So we are using the Clarius to evaluate the structures in this area, and we can identify the bone, the muscle, the deep fascia, and superficial temporal fascia, the dermis, and the skin. So it is a really nice thing. And what we are going to do is we are going to take a picture. Just click on the thing, on the camera thing. Yeah, perfect. And then one more picture. Perfect. And then now we go to the mode, change to color Doppler, and we just so now this is where the vessel is. Let's look up the vessel. Take a video. So the next one down. Yeah. Wait, I'll tell you. Okay. Because I'll only take it for a few seconds first. Is that your tummy?
I don't know whether it's...
Okay, there it is. Okay, video. Keep it going. It will stop on its own. Okay, start the video. Yeah, so we use very low pressure. Is the light on the microphone? We use very low pressure retrograde, so we only inject when we are pulling back injections, and the injection is going right on top of the deep muscle fascia, and the opening of the cannula is pointing down. So all of these little maneuvers are helping to reduce the risks of complications. Um, we are not in a rush to inject. We inject tiny bits as you go in. To about 5 passes. So I never know how much I'm doing, but what I'm the sensation of the cannula, because when you do temporal lifts, you know how thick the deep temporal fascia is. So you can actually run along it. It is quite a vigorous structure. So basically, because all the vascular pedicles are going into the superficial temporal, uh, this is a complicated anatomy. So, and the idea of using the Bellator volume is that it's a very pliable filler. You can massage it and stuff. So let us put it more in the front. Okay. Yeah. So right now I am actually volumizing the natural fat pad. This is called a roof fat pad that we lose with age. And if you lose that fat pad, one of the consequences is the lateral hooding where the skin kind of couples down. So by treating this area, you reduce the lateral hooding of the eyes. So I'm basically massaging this area to ensure that it's all lying very smoothly. Mukda, sit up for me for a second, straight ahead, come from the front. Yeah, stay there. So you can immediately see that this area is no longer as deep as that area, and you can see that this brow tail is now more supported. It doesn't look as hollow. We need to give a little bit more there because this was the deeper side, but first we will do this side and then we'll come back to right side. Okay, same thing. Yeah. Okay, this side it's even better. Take a video. Video? Yeah. You're not taking it. Ah, no. Rico. Oh, no worries. I'll let you know. I'll see. I'll get you to sit up and I'll see. If I think we can do it later, we'll do it after 2 weeks. Okay, sit up. Let us sit up. Now go down. Sit up. Sorry.
Recording.
So I've finished the fillers. We have probably put about 1.3 mils on this side, or maybe 1.4, and the slightly less, maybe zero point 0.7 on this side, because this side had a bigger deficit. I've evaluated her in the sitting up position, and I find that she looks pretty good for now. The option of putting more fillers is always there, but because the filler will draw some water and plump out ever so slightly more than what has happened today, we will get her back at 2 weeks, evaluate, and if required, we can always put more. To just have a feel as I'm doing, and I'm making sure that the product is lying uniformly and there are no bumps under the skin. And I'm happy with that. We will now do an ultrasound to make sure that the vessels are running the same way they were before, and that will conclude the procedure. Okay, so the blood vessels are take a video. The blood vessels are going just as I saw them initially, so it's not having any issues with the blood vessels. I can see the product placed over there in the interfacial plane. It's spread out very well. So that's where the product is. That's the deep temporal fascia. It's just between the two facial planes, so that is good. And we'll do the same on the other side now. So even on the left side, there is blood flow just as before. So there is no impeding of the blood flow. So we have checked and made sure that there is no involvement of the vessels in the fillers and that the filler placement is right. We'll give her a final wipe and we'll take some photographs for the immediate post-op period. So